Assalamu alaikum. I am Aleeha Zar, and today the case study I am going to discuss is infertility caused by oophoritis in a dog, and that is resolved by hemi-ovariectomy. The canine oophoritis is a rare cause of infertility. When we are talking about the different challenges that causes the canine infertility, the most important one is inappropriate breeding time, the poor semen quality, and infectious diseases such as the brucellosis. And the last one is ovarian structural pathologies. As of this case study, the inappropriate breeding time, semen quality, and infectious diseases were all ruled out, and the main cause was canine oophoritis. It is a rare ovarian pathology in which there is an inflammation of the ovary, and the prevalence is 6.6 to 7.9%. It is a very rare pathology. In this case study, we reported the dog with the canine oophoritis and then treated it with hemi-ovariectomy. In the next slide, there is the patient history and cycle abnormalities. The dog was presented at the clinic. Its age was 5 years old, and the more major abnormalities it showed were abnormal estrus cycle, shortened inter-estrus intervals, and failed to show the appropriate progesterone level uh, in multiple attempts. Initially the brucellosis was suspected, but it tested negative for brucellosis, and the previous treatment that was done was prescribed compounded mebelron to extend her inter-estrus interval, but of course the treatment failed. When the diagnostic procedures were done in the serum chemistry, the initial progesterone concentration were 5.91 nanogram per ml. That showed the ovulation and suggested there might be the potential ovulation in the bitch. But when the cytology was done, the vaginal cytology showed us that there are less than 10% cornification in the vagina. This is the contradiction between the hormonal and the cytological findings, and it was unexplained. When the ultrasonography was done in the image findings, when the ultrasonography was done, the uterus was normal. In the ovary assessment, the ovaries were heterogeneous and asymmetrical. The right ovary was normal with a 0.2 centimeter anechoic structure on it that can be potentially a follicular cyst. On the left ovary, that was significantly enlarged, measuring up to 1.8 to 2.5 centimeter. And there was a nodule on the left ovary that was 1.7 centimeter hypoechoic vascularized structure in the parenchyma. When we talk about the differential diagnosis of this condition, it may be a complicated cyst, it can be an atypical functional body, or it can be a neoplasia. When in surgical rationale, the neoplasia became the leading suspicion because of the significant change because the nodules lack the significant change in the persistence or in the shape. The owner, for the treatment, the owner was given the choice of the hemiovariectomy, and it chooses for the left hemiovariectomy to conserve the dog's breeding potential. When the surgery was done and the ovary was removed, upon bisecting the ovary, we did the gross pathological or gross surgical findings. We found a cavitated center, and the black mucus oozed out of the cut surface. This ruled out the neoplasia, because in neoplasia there must be the solid mass and not the mucus oozing out. For histopathology, the histopathological result confirmed that the tissue that was extracted from the removed ovary was not neoplastic. When we come to the definitive diagnosis, the granulomatous oophoritis was the definitive diagnosis. It is characterized by the chronic inflammation and fibrosis and hemorrhage. In this slide, you can see the left ovary that was removed and it is bisected, and there the marked structure is the black cavitated structure that was present in the ovary. And when the histopathological test was performed, you can see the neutrophilia and the granulomatous oophoritis. Post surgery, the dog successfully returned to breeding, and the estrous cycle of the bitch after the surgery was normal. There were no abnormalities shown, and progesterone levels were appropriate, measuring up to greater than 20 nanogram per ml. When we talk about the breeding success of the dog after left hemiovariectomy, the dog was naturally bred and confirmed pregnant, and it whelped 6 healthy pups right after the surgery litter. In long-term outcome, it went on to the whelp 3 more litters before retirement. When the comparative pathology and discussion was done, the etiology of the granulomatous oophoritis in this case remains unclear. When we do the species comparison in pigs and cattle, it can be due to the live vaccines. In human women, it can be due to the autoimmune diseases such as the Hashimoto's or Addison's disease. While the dog in when we talk about this specific dog's profile, it lacks the vaginal cornification, hypoestrogenism, along with the findings of the autoimmune, so along with the findings that resembles the woman's autoimmune oophoritis. However, the typical Addison disease was ruled out, but there can be a link to other autoimmune conditions. It was not tested. Uh, while concluding the case study, the pathophysiology, we will discuss pathophysiology. The pathophysiology in this case were of elevated progesterone. It was likely due to the luteinization of the follicular wall without actual ovulation. And the oophoritis was the definitive cause of the estrocycle abnormalities and the infertility in the bitch after so many breeding attempts. The key learning points in this case study are that the oophoritis can be considered a major cause of the infertility in the dogs, and for the treatment option, the hemiovaryectomy can be a curative treatment option, and it does not affect the breeding career of the dog. The future research can be done in determining the link between the oophoritis and autoimmune disease or the Addison's disease. That's all from my side. Thank you so much.